New virus spreading in China raises global concerns. Could it be more dangerous than COVID-19? A new virus reportedly spreading in China has sparked global concern, raising questions about its potential severity and whether it could pose a more significant threat to public health than COVID-19. Health authorities, scientists, and international organizations are closely monitoring the virus's spread, its symptoms, and its transmission dynamics. Understanding the new virus. The virus, initially identified in northern China, has shown a rapid rate of transmission, leading to a rise in cases in affected regions. Early symptoms include fever, respiratory distress, fatigue, and headaches, resembling early COVID-19 symptoms. While initial reports suggest a relatively high recovery rate, health experts caution against underestimating the virus's potential impact. Unlike COVID-19, preliminary studies indicate this new pathogen may have a shorter incubation period, increasing the risk of community spread. The virus is suspected to have zoonotic origins, with health experts investigating its potential link to animal markets or cross-species transmission, a scenario reminiscent of the initial outbreak of the coronavirus in Wuhan in late 2019. Global implications and concerns. The World Health Organization (WHO) and other global health agencies have expressed concern, urging countries to remain vigilant. While it's too early to determine the virus's exact lethality, scientists are focused on understanding its genetic makeup and mutation potential. The fear is that mutations could enhance its transmissibility or resistance to current antiviral treatments. The virus has also raised alarms about its potential to disrupt economies and healthcare systems worldwide. As countries struggle to recover from the lingering effects of COVID-19, a new health crisis could further strain global resources. Comparisons are being drawn to SARS, MERS, and other coronavirus outbreaks, highlighting the need for proactive measures. China's response. The Chinese government has implemented immediate containment measures, including lockdowns in affected regions, increased testing, and the isolation of infected individuals. Researchers in China are working around the clock to sequence the virus's genome, hoping to accelerate vaccine development if needed. Authorities have also ramped up public awareness campaigns, urging citizens to follow strict hygiene practices, wear masks, and avoid large gatherings. Despite these efforts, critics argue that China's initial response lacked transparency, which could complicate global efforts to contain the virus. The role of vaccination. One critical question is whether existing COVID-19 vaccines could provide any protection against this new virus. Preliminary findings suggest that while some vaccines may offer partial immunity, the virus's unique characteristics require the development of specialized vaccines. Pharmaceutical companies worldwide are closely collaborating to fast-track research. Comparing the threat to COVID-19. Experts emphasize the importance of understanding how this virus compares to COVID-19. While the coronavirus had a wide-reaching impact, shutting down economies and claiming millions of lives, this new virus's potential danger lies in its unknowns. Factors like its reproduction rate R0, mortality rate, and ability to evade current treatments will determine its long-term impact. Call for global cooperation. Health experts stress the importance of international cooperation in addressing this emerging threat. The experience gained from handling COVID-19 has better prepared global health systems, but there's no room for complacency. Immediate action, including surveillance, data sharing, and research funding, is critical to mitigating the risks. Public awareness and preparedness. As scientists and governments work to understand and contain the virus, public awareness is crucial. Individuals are advised to stay informed, follow credible news sources, and adhere to guidelines issued by health authorities. Practicing basic hygiene, avoiding unnecessary travel, and seeking medical attention for unusual symptoms remain essential precautions. Looking ahead. While it's too early to predict the full scope of the new virus's impact, the situation serves as a stark reminder of the importance of global health preparedness. The world is watching closely as scientists unravel the mysteries of this pathogen. As more details emerge, collaboration and vigilance will be key to averting another global health crisis. Stay tuned for updates as we continue to monitor this evolving situation.